It is my pleasure to welcome you to NEDAcon Spring 2021's Mental Health Responsibility Through Policy Changes panel. I'm Chelsea Cronengold, NEDA's Associate Director of Communications, and today it is my pleasure to welcome three of our social media partners to discuss the work they are doing in 2021 to create a safer, more inclusive space for the eating disorders and body inclusive community, as well as promote mental health and well-being through their policies and in-app products. I'd like to introduce our three panelists today. Representing Tik Tok, Tara Wadhwa serves as the Policy Director on the US-Canada Trust and Safety team. Dayna Geldwert is a Policy Programs Manager at Instagram. Representing Pinterest, Bromma is the Head of Policy. We are delighted to have each of these representatives here today to talk about some of their work. To get started, I'd like to ask each of you to introduce yourselves to our audience and talk about the work you do with your company related to policy and safety. I will start with Tara.
Thanks, Chelsea, and thanks to you all. It's such a pleasure to be here. My name is Tara Wadhwa, and as Chelsea said, I serve as the Policy Director for our US and Canadian Trust and Safety teams. The work that our team really does is to develop the policies that will keep our users on app feeling safe and secure so that they can really express who they authentically are on our platform. Before coming to TikTok, I spent a decade as a researcher and administrator at the NYU Stern School of Business, where I researched human rights commitments and how corporations could leverage those commitments and their supply chains to make sure that human rights were being maintained. Lastly, I'd just like to give a shout out to everyone at TikTok who's working so hard on these issues and our partnership with NEDA that's been so influential during this time.
Thank you. We've loved working with the entire TikTok team on all of the great changes that you will be discussing. Next up, Dayna, you want to introduce yourself?
Yeah, hi everyone. My name is Dayna Geldwert. I'm a Policy Programs Manager at Instagram that's focused on protecting the safety and well-being of our community. What that looks like is I work with governments, civil society, and organizations on areas such as bullying prevention, mental health, negative social comparison, eating disorders and body image, and also digital literacy and digital wellness. I also like to think of myself as kind of the bridge between external experts and our community members and our internal policy and product teams. So oftentimes I'm working with external researchers, practitioners, experts, individuals on our platform who are doing incredible work to try and feed their feedback back into these teams to ensure we're creating the safest, most supportive, most positive experience on the platform.
Thank you. And we've also really enjoyed our partnership and working together with Instagram over the past couple of years as well. And last but not least, Sarah.
Hi everyone, I'm Sarah Bromma and I'm the head of the policy team at Pinterest. So my team basically sets the policies for what we do and don't allow on Pinterest across both content and advertising. And we work with lots of experts like NEDA and other external experts, as well as getting feedback from our pinners to set those policies and really try to make the policy support and advance our mission of inspiration. And prior to coming to Pinterest in 2018, I spent most of my career in DC supporting national security policy. So thanks very much for having us again, Chelsea.
Thank you, Sarah. And Pinterest is one of the newer social media partners we've been working with, and we love the work that we've already started to do, especially during NEDA Awareness Week, and look forward to working with all three companies moving forward on the incredible mental health and particularly eating disorder policies and safety tools that you have in place. So from there, I'll move on to the next question. What changes has your company made to create a safe space for your users?
At Instagram, we don't allow content that promotes or encourages self-harm and eating disorders, but we do allow people to share their experiences and their journeys around eating disorders, body image, and body acceptance. We've heard that it's really important for people to find community around these experiences. And one of my favorite creators, one that we've worked with across NEDA and Instagram, is Sam Dillon Finch, who lives with an eating disorder. And he once described Instagram as his visual journal, where he is sharing what he's thinking and learning throughout his recovery. and mentioned that recovery really takes a village, and his Instagram community is kind of part of that community. So we want to protect that community building, but of course, we also have to make sure that the platform is safe. So when we think about keeping Instagram safe for individuals struggling with eating disorders and negative body image, we're really focused on two main areas. So the first is tools and resources that are available directly within the app. And then the second is expert and community engagement. So in the first hand, for more than 5 years, when someone has searched for or posted content related to self-harm or eating disorders on Instagram, we had historically surfaced a single list of hotlines and general tips. But over the years, we heard from partners like NEDA that it's actually more helpful for us to separate that out and to provide tailored resources for each of those different problem areas. So that's why just this year, we launched a dedicated eating disorders and body image resource flow on Instagram. So now when someone searches for or posts content relating to eating disorders, we will actually point them to their local eating disorder help hotline. They'll also be able to access evidence-backed related content on Instagram that is focused on tips for mitigating negative body image and eating disorders. This is something that we developed with NEDA and is available globally. We also made similar changes on the reporting side. So previously, when you reported something, it went through the same flow for suicide, self-injury, and eating disorders. We've now broken that out so you can report a specific piece of content for specifically eating disorders. And then lastly, we've also developed what we call a classifier around eating disorders on Instagram. What this does is it's technology that allows us to proactively determine when there might be content posted that goes against our policies around promoting and glorifying eating disorders. This means that you don't actually have to report something to Instagram. We can actually proactively find it and send it to reviewers and determine if it violates our policies. And the second bit is the bit that I'm most passionate about, which is our community and expert engagement work. So this is something that we have been doing for nearly 8 years with the National Eating Disorders Association. We have been working side by side with you for so long. And about 3 years ago, we really took it to the next level when we developed these proactive, creative campaigns around National Eating Disorders Awareness Week. I have personally worked on this campaign for the past 3 years, and it's some of the most meaningful work that I have done in my career. And really at the center of these campaigns is elevating and centering the voices of people with lived experiences with eating disorders. So how can we find individuals from potentially marginalized communities who don't often see themselves reflected in mainstream conversations around eating disorder recovery, and give them a platform to inspire others and help others know that they're actually not alone. So we have been doing this for the past 3 years. There are creators that I love on Instagram, from James at James is Smiling, to Kendra Amorous, to Jude, Mermaid Queen Jude, who is this absolute badass gamer, queer Latinx, who talks about how she wants her community on Instagram to be one that is just about throwing away perfectionism and throwing away social comparison, and actually just about radical self-love and body acceptance.
Incredible. Thank you so much for the work that you and the Instagram team have done, especially the NEDA Awareness Week partnership. It's always been really fun working together with you and highlighting voices that aren't often shared and leveraged in the eating disorder community. So thank you.
So the work that my team is doing around eating disorders, but also just user safety, is our top priority at TikTok. I think user safety is the thing that keeps us up at night, but also keeps us driven to make sure we're maintaining a safe, inclusive environment for all of our users. I'd start with the ground floor of policy. So refining and iterating our policy with the work of experts and partnerships with those like NEDA, who have all of the authoritative expertise in this area, and really bringing it to meet people on TikTok where they are. Those policies are evergreen, but of course we refine them as we get more information coming in and see them evolve over time. The second one I'd want to lean into is the partnerships that we have with folks like NEDA, finding ways to have our policies really come to life through the app by having in-app resources that connects those that might be struggling with an eating disorder to folks like yourselves at NEDA to make sure that they have the resources they need, that they're not feeling like they're alone or isolated or they don't know where to go, but rather that right in app when they're having a self-doubt moment or searching for something like anorexia or bulimia, instead of just finding a blank page, they're actually finding those resources, helplines, and websites that they can go to help make sure that they're finding the community and tools that they need to overcome the challenges that they're facing. And then the last is once we have everyone feeling safe and comfortable on the app, we want to make sure that the product solutions that we're driving towards are just reiterating those policy positions and the resource and support that we want to provide the community. And so we have customizable tools that will help you navigate your own experience, because we recognize that everyone is in a different place in their journey of recovery or community in this way during this issue. And so we just want to make sure that if something might be triggering to you, you can long press on a video so it's no longer visible in your feed. Another option is you can filter your comments so you can make sure that the things that you're seeing are not going to trigger you when you receive comments on your video. A couple of examples of how our community has really been thriving in this area touch on not only the lived experience of those that have battled eating disorders before, but also those that are their allies and biggest supports. So one of my favorite ones that we saw during NEDA week was actually a dad teaching himself not to comment on, are you still eating more or didn't you just eat? Because he realized that leads to self-talk in his daughters and sons that he didn't want to see them experience. We also saw this wonderful creator that came online, and she created a green screen effect that made it look like she was on a Vogue cover. But she was on a Vogue cover with no makeup on and rolls and all, and looked beautiful. And I just loved to see the community come together in that way. So if there's one thing that our team defines as success, is that people can authentically be themselves, who they are today, no glitz and glam, just true to themselves.
Absolutely. Thank you. And all of those, what seem like small little steps, really do make such a difference for the users on the platform. So thank you.
You know, our main goal, as I said in my introduction, is really to inspire pinners with useful and relevant ideas, right? That's our company's mission, is to bring people inspiration. That might be taking on a new craft, a new project, or finding ways to live a healthy lifestyle. And so we really want to make sure that users see content that inspires those types of activities and make sure that they don't see anything that's inappropriate. And we try to take, I think like others, try to take a really comprehensive view to how to make a safe and inspiring platform, right? So I think for us, it starts with our policies. We need to have strong policies around harmful content, and such as self-harm and eating disorders. But then we want to go further than just say, like, you can't post this stuff, or we want to take the harmful things off. We want to then help connect pinners with resources that they might need. Help amplify positive, inspiring, and authoritative content on important issues like public health or wellness. And then lastly, we want to really think about how the platform works, right? And build in features that kind of help amplify or encourage, again, wellness and positivity, inspiration. And throughout each part of that process, from developing the policies to what types of features, what types of resources to connect people to, we want to work with outside experts like NEDA, and also to get feedback from pinners on what they want to see and what works well for them. So first, on our policies, which is what my team is focused on, our priority, as I said, has always been to create that positive and inspiring place for pinners. So we either remove or limit distribution of content that we think goes against that mission. And that includes harmful and misleading content that might harm pinners or the public well-being. So again, we have clear policies around things like self-harm and harmful behavior. Our self-harm and harmful behavior policy prohibits content that displays, rationalizes, or encourages eating disorders, as well as other types of self-harm like self-injury or suicide. And then we've also had long had other policies around health issues, like our health misinformation policy. We first developed this actually back in 2017. And under that policy, we don't allow things that promote, for example, content that promotes anti-vaccination advice, or promotes false cures for illnesses, or other types of misleading health content, of course, now including misinformation about COVID-19. And then additionally, we take a similarly strong approach on our ad policy side. So we also prohibit ads that use body shaming language or imagery, or before and after weight loss imagery, or we don't allow ads for things like dangerous weight loss claims or weight loss supplements or things like that we think would be harmful to our pinners. And then, then basically we have to go out from just not focusing just on the policy, but then how can we connect users, our pinners, to authoritative resources or helpful resources. So kind of on that end, we know that feeling inspired and planning for your future can be really hard if you're struggling with personal challenges, right? I mean, I think this past year really brought that to the forefront for a lot of us. It's been a difficult, year for many of us. So again, we want to help raise awareness around important health issues, and we want to try to connect pinners to resources. So that includes partnering with NEDA, for example. So if pinners are on Pinterest and they might be searching for something that is relating to eating disorders, we show them an advisory and provide them with information on how to reach out to NEDA. We send them to the NEDA website. We do that for other issues like, if we think someone might be having suicidal thoughts, for example, we connect them with a National Suicide Prevention Lifeline. And we also want to help amplify positive content, right? Not just sending people to resources when they might be in need, but helping amplify content. So like for National Eating Disorder Awareness Week, which you mentioned, Chelsea, we really wanted to amplify that content and help raise awareness for that issue. So we highlighted content from NEDA in our Today tab, and we do that for other kind of public health and wellness issues as well. So really just trying to take a more comprehensive approach on having strong policies and taking down the bad content, and then helping elevate that positive content and connecting people to resources.
Great, thank you. And I think a common theme that I've noticed, both working with all three platforms as well as hearing you speak today, is that you're setting up the policies, you're the experts in that within your own individual platforms, but then also recognizing where that expertise ends and where you're using, as Dayna mentioned, whether it's evidence-based tips or consulting with NEDA and other experts and organizations as well. And that's it's incredible. And we're so grateful that you're responsibly getting this information out as well. So again, thank you. Do either of you or any of you have questions for each other about your policies before we move on to the next question? And it's okay if you don't. Just want to make sure this is like dialogue, so many, if you wish.
So many, but maybe we'll do that
offline.
Yeah. I mean, it's always really interesting. I mean, we try to make sure that we kind of know what other platforms are doing, what is working, what isn't working. We try to learn from others, whether that's reaching out to people directly or it's in conversations with third-party groups like yourselves. We often, different platforms are working with the same outside expert, right? For example, with NEDA, or on other issues, we might all be working with, a public health expert on COVID-19, for example. And those are great opportunities to share lessons learned, share trends that we're seeing. I mean, I think none of us are islands unto ourselves, right? We know Pinterest, for example, you can save content from all over the internet. So of course, things migrate from platform to platform. So it's really helpful to be in touch with people at other companies, to learn lessons, to see what great best practices are out there, who the experts are that they're connecting people to. That's always really helpful for us. We don't exist in a vacuum, of course. And so, I think it is really helpful to stay in touch with our partners at other companies.
Yeah, and also to keep abreast of any trends. So oftentimes when you see problematic or concerning trends happening on one platform, it's not uncommon that it's happening on another. And so it's really helpful for us to stay close in touch to make sure we're kind of taking a comprehensive look at this problem area, working with external experts to help us adapt to it, modify any policies that we need to, enact new ones, look at potentially new features and tools, and figure out how you can kind of root out that type of behavior across platforms.
You all have your own individual missions within each company, but especially as policy and safety teams, you really do have a shared goal. And that's pretty clear here from this conversation.
Of course, yeah.
As Sarah mentioned, it's been a wild year, especially in terms of COVID. So how has COVID-19 affected policy decisions related to eating disorders and mental health issues?
Yeah, so I think, Pinners' emotional well-being has always been really top of mind for us. But again, I think this past year just really brought that to the forefront for all of us personally, and then as well as just thinking about our communities and what needs they might have. This past year, we've been seeing that trend on the platform, right? I mean, we've seen that people have been increasingly looking for mental health resources, ways to try to stay positive throughout this hard year, or just ways to cope with the situation that they're in. For example, in 2020, we saw that Gen Z pinners turned to Pinterest for inspiration on ways to stay positive and healthy, despite everything going on, with searches like mental health check-in was up 5-fold on Pinterest, and mindful eating was up 44%. So we can learn a lot just from what people are looking for on the platform. And again, I think we try to approach this year like we've approached, safety generally. Like I mentioned earlier, we want to have strong policies around harmful content, which of course includes harmful content around COVID-19, as well as around self-harm issues, and to help connect pinners with resources that they might need. For example, we regularly update all of our policies. It's a constant. I think everyone in policy would say, like, it's never really over, right? You're always adjusting, learning about new trends, thinking about how you can better serve your community. So just this past year, we updated our self-injury and harmful behavior policy, in part based on guidance from the Samaritans, actually, who we work closely with on self-harm. And also we sought advice from NEDA on weight loss issues as well, that we're incorporating. And then again, we try to connect people with resources. So again, during National Eating Disorder Awareness Week, we really wanted to try to amplify content around educating pinners and really helping them think about these issues and connecting them with those resources. Early on in the pandemic, when it's hard to imagine, it was only just a little over a year ago, but when we were all kind of going into lockdowns in March of last year, we sped up kind of our compassionate search feature. We made it more available to more users on Pinterest, because again, we saw those searches really coming up. We saw searches for calming quotes on Pinterest double in March of last year, stress relief searches triple. And so we sped up the availability of our compassionate search feature, which is a series of emotional well-being activities that you can come to directly from within Pinterest. You can either search for them directly using hashtag Pinterest wellbeing, or if you search for things like anxiety or sad quotes or stress relief, it actually brings up an option to connect to these resources. So we had developed them previously, but we saw that need and tried to make it more available on more platforms and to more users around Pinterest. We developed those with emotional health experts, and they're designed to kind of help you improve your mood. They don't replace professional care. So again, if we think that someone might need more professional care, we redirect them to the appropriate resource. But there are nice exercises to do to, again, think about things mindfully to improve your mood, for example. At the same time, early last year, we also sped up the launch of our Today tab, which now we've used to highlight some of these issues. So the Today tab is kind of a source of daily inspiration. There's curated topics and trending pins and things like that. But we've also been able to use that to help get out, reliable content to users during this past year. So we've done a lot of features, including just one this week on COVID-19 information from health experts, from the CDC, the WHO, and from other health experts around COVID-19 information people should know, around National Immunization Awareness Month, all sorts of different kind of public health issues. It's been a great way for us to, again, get resources out to people. And then specifically on COVID, which you asked about, I think I mentioned earlier, we've long had a health misinformation policy. So we actually first developed that back in 2017. It's been updated several times since then, of course, but thankfully we had that in place when COVID broke out. So we saw the trends going on, that there was misinformation almost immediately spreading about the virus and the pandemic as early as January. So we were able to kind of jump on that quickly. Again, work with others in the industry, work with public health experts. Thankfully, there's been a lot of kind of public-private partnerships on this, really trying to make sure that people have understand what is misinformation so that we can then go take it down or try to debunk it for people. So we immediately jumped on any health misinformation around COVID-19. We launched a new expert search feature for COVID-19. So if you're on Pinterest and you might be looking for COVID-19 information, we only serve you reliable results from public health organizations. And we have an advisory that sends you to WHO's COVID page if you want to learn more. And again, we've tried to amplify reliable information about COVID in different places on the platform. So we kind of approach that the same way we approach lots of other harmful types of content out there. Take down the bad stuff and try to help elevate the good information out there for people.
Really early on, Instagram was speaking with experts that told us that we were really facing two big pandemics, right? We were facing COVID-19 and the physical impacts of it. And then we were facing this mental health pandemic, which was just the absolute increase in individuals struggling with their well-being during quarantine, during isolation, and during COVID. And so we also recognized that during this time, people were spending a lot more time online. It was the way that they could connect with one another and connect with their exercise classes, or with a way to learn how to knit, because they've always wanted to learn how to do that. For me, it was calligraphy. But we felt a really, really grave and great responsibility at Instagram to ensure that if you were spending more time on our platforms, we had to make sure that that time was well spent. And we had to be proactive in making sure that you were being connected with the mental health and well-being resources that was so critically needed at that time. So back in May of last year, we launched this tool called Guides. It's a new way to find and discover curated, reliable resources and information from experts and publishers and creators. And when we initially launched it, we made it very, very exclusively around mental health and well-being. So we partnered with organizations like the American Foundation for Suicide Prevention, the National Alliance for Mental Illness, of course, NEDA, to develop these guides that were really tailored to the issues that young people and the general public were really facing then. So how to manage grief during the pandemic, or what to do if you're feeling incredibly anxious, or what to do during mealtime if you're struggling with an eating disorder and you feel like you don't have your network around you. So this was a really great tool that we've since expanded since May, and we found different ways to amplify those guides and really connect people with these resources from reliable, credible, accurate organizations and experts. The last thing that I think is just amazing and a testament to all of our communities, I think, Sarah, you talked about this perfectly with how this manifested on Pinterest, and Tara, I'm sure on TikTok as well. It's just how creative people are and responsive they are to what's going on in their lives, and making sure they're building productive communities around that and supportive communities around that. So we saw an account pop up called COVID-19 Eating Support, and they were hosting Instagram Lives every single day during mealtime so that you could have mealtime support if you were struggling with an eating disorder. There were all of these accounts that were trying to help you accept your body if it was changing during COVID, or how you can connect with other individuals if you felt really isolated with your eating disorder during this time, and find really good support. So I think for us, beyond what we did as a platform, we were really, really inspired to see what our community has also done to kind of support one another and show up for one another.
Great insights. I think some of the things that we saw as the pandemic took over was everyone being less connected to one another because of the isolation, and also that just exacerbating existing issues and insecurities that could come up like they do around eating disorders. And so while our policies remain evergreen and those safety standards are things we prioritize and keep in place, it was also about how do we foster more tools and resources for those that might need them, by creating campaigns like we did with NEDA Awareness Week, but also by just programming and providing resources to those that could be looking to connect with them. The thing that was, again, so inspiring for me was just to see the creativity that came out of this sort of making lemons out of lemonade during this past year, and to be able to make sure that everyone felt safe to express how they were authentically feeling, whether it was sluggish and not great, but also that they are feeling energized and wanted to do their at-home dance class with the grandmas that they found a community on with TikTok. And it was really inspiring. I think a couple examples that really spoke to me was there's this one very long stitch chain where you have different creators duetting each other and putting each other in their videos just to say, this is me and who I am today, and who I am today is doing great and I am enough. And how many times do we need to hear that before we really believe it is something that's really impactful for me. And I want to see everyone else sort of creating the same. Another really great example was around the hashtag Eat With Me. And so it was just one person who had a really close friend that struggled with an eating disorder. And she said, you know, you're home alone, but it doesn't mean you have to eat your meal alone. And even if it's just one bite, I'll be here to eat that one bite with you. So it was really great to see the community coming out in all different ways to support one another and just embrace who they authentically are in this moment and say, it's not easy and we've been having a hard time, but with each other, we're able to have these really fun times as well. And so we're eager to maintain, as the New Yorker called us, the last sunny corner of the internet.
Each of our platforms have played a really important role in destigmatizing these conditions and these realities for so many people. I think the exposure, the visibility, the vulnerability, the sharing, the community building, all of that has been really, really important and instrumental in helping more people have these conversations, feel comfortable talking about this, and also having the courage to seek more help if they need it.
The communities are all so vibrant and they all contribute to one another. So it's great that you can go on TikTok and find DIY or cooking videos that you might not have experienced before, but then also change gears and go on to Pinterest and see all the things that could inspire you going forward. So it really is all of us together that are going to make people have community around this time when everyone feels a bit disconnected.
To wrap up our conversation today, what do you think is next for your platform to move forward in continuing to create a safe and inclusive environment for eating disorders and the body inclusive communities? So you're all doing fantastic work, and we know that it's just the beginning of all the great things that can come. So we'd love to hear some ideas that you have for the future.
There's no finish line when it comes to safety. This type of work, whether it's policy iterations, refinement, or learning the most up-to-date research to funnel back into our policy, is something that we'll always continue to do. But the thing that we're most focused on now is really how can we make sure that we're getting the user feedback that we want to tell us how we can make sure that they're not feeling triggered, or what kind of customized tools they might like to have a better experience on the platform. So really driving towards that inclusivity of, here are the options that you have for your own tailored experience on TikTok. What does that look like for you? And then how does that connect to the experience of others that you've found? Whether it's you yourself going through something and wanting to share that and find community, or if you want to know how to help a friend and you need someone to help guide you in what the best and most appropriate way to do that is. And finally, if you're really struggling, what are the resources that we can send you to, like NEDA, or if there are other wellness things that we can provide, to lean into those resources so you can have that experience and it meets you right where you are on the TikTok app through the different creative outlets that we're able to provide.
It's already been said, like, this is an ongoing thing for all of us. Our work is never done, both across the policy, how we enforce our policies, and then also the features that we build into the platforms. I mean, we're always thinking about new ways we can better support the community in our mission. We're also always listening to feedback, like from experts at NEDA, from our pinners, for example, to think about how we should update our policies, what features would best serve them. We have more policy updates around this issue coming out later this year, so stay tuned for that. We also are continuing, different teams around the company continuing to think about this and the content that we feature and the creators that we work with. The features that we put in our Today tab, for example, we've done a lot of body positivity features there, thinking about size inclusive fashion, and really how we can amplify that. So, you're not just seeing the same thing over and over again on online about, what to wear, or what people look like, things like that. So really just trying to be more mindful of this in all parts of the platform, I think is how we're trying to think about it. And, again, learning from our pinners. I think we've all mentioned being inspired by the people who use our platforms is really, it's just really amazing. I think it hits home for me and for my team about why the work we do is important, right? One pinner that really kind of hit home for me was Emma from Portland, Oregon. She actually came in person back when, we could actually see people in person. She came in person to Pinterest to share her story with the company. And she talked about how she used Pinterest in her recovery as she was undergoing treatment for an eating disorder, and to really plan for her future, to think about what her life would be like after her recovery. And she talked about how on Pinterest, she felt like she was building her future, or her vision for a healthier future, and a more independent future. She shared that her boards were more than just recipes and photography and fashion and quotes, which you could see on her boards, but her boards were really her hopes and plans for her life after the difficult time that she was facing. And so that is just really inspiring for us. Like, how can we keep people inspired? How can we help them through difficult times they might be facing, whether it's COVID or just personal challenges that they're facing? And again, it was just a good reminder of why we need to keep working on this and keep improving the experience for our users.
We launched a tailored experience for individuals when they post or search for eating disorders content on Instagram, and we connect them with local eating disorder hotlines. This is something that we rolled out in many markets in many countries around the world, the US, Mexico, Israel, Middle East, Australia. But there are a lot of markets that we haven't rolled this out in with local help hotlines. And that's often because either they don't exist or we don't know who they are yet. And so I'm really looking forward to us making sure that we're applying equal support globally with local resources so that we can support our community as best as possible. That's very tactical. At a higher level, I do think we need to continue working really closely with our community who are affected by these issues. You know, around National Eating Disorders Awareness Week, we did host a feedback listening session where we got our engineers, our product developers, our policy leads, marketing, partnerships, all into a room to listen to 3 different creators who have experience in these spaces, to hear from them. 1, how are you experiencing Instagram? 2, what can we be doing to better support you and your well-being? And 3, you know, how can we create new products, policies that actually foster the type of interaction that you love to see on the platform? And so we take that feedback and bake it directly into new products that we roll out and policies that we roll out. The last thing is just continuing to figure out how we can elevate these really inspiring creators on the platform. I just today discovered someone with the handle Make Love, Not Diets. She's based out of the UK. She's 23 and she's doing incredible content on Reels, where she's not just talking about accepting and loving your body, but she's talking specifically about how social comparison and pressures may show up on Instagram. And we don't want to shy away from that. We actually want to embrace it and understand what are the pressures that people feel on the platform? How can we actively reduce them? How can we elevate voices of people who are pushing against that? So social comparison, negative social comparison, it's going to be something you see a lot more from us in the next few months and years. And I'm really excited for those things to roll out.
What we really want to drive home for our users is we want you to authentically show up as who you are in this moment and to feel comfortable doing so, whether that's feeling vulnerable in recounting the awareness or the experience that you've had with eating disorders, or if it's that you struggle with a friend or family member that's having these having body inclusivity issues, or if you're just like me, who has probably spent more time sitting behind my desk during the past year and less time outside walking around, and all of the self-doubt that can come along with that kind of messaging that we see. So really, how do we make sure that we have a safe platform where people can show up to be who they authentically are in this moment and have no shame or fear around that, but only to seek community with one another?
So with all of the great stuff that happens on social media, we know just by the nature of platforms that there are potential for triggering content to come up. And so in closing, what advice would you give to your users who might come across this content? You're all doing great work at trying to mitigate this type of content, but you know, the nature of platforms, sometimes things slip through the cracks or they're not easy to identify right away. So what advice would you give to people who come across this, who may be struggling both on the platform and offline?
If you come across content that feels triggering or potentially violating on our platform, please, please, please do report it to us. We want to make sure that we're taking down content that shouldn't be on Instagram, particularly if it is promoting or glorifying or encouraging eating disorders. But I think at a broader scale, it's really hard to pinpoint what may be triggering for one individual and someone else. It's highly individualized. It's shaped by your personal experiences. And so we have actually had a lot of conversations about this with creators and individuals who have struggled with eating disorders and body image issues. Just that session that I mentioned happened in February. This was one of the key questions we asked them was, how do you create boundaries for yourself? And I think a few key themes bubble to the top. The first is really being intentional and thoughtful about who you choose to introduce into your digital spaces. And what I mean by that, and what they mean by that, is really culling your follow list. Who are you following on Instagram? Are they serving you positively? Or are they making you feel bad about yourself? Are you finding yourself comparing your body and yourself to theirs? Are they not contributing positively to your day? And if the answer is no to that, then consider muting them or consider unfollowing them. A lot of creators will say that you need to protect your digital spaces just as you protect your physical spaces. And so being intentional about who you follow and actively considering, or actively thinking about times to do some spring cleaning and unfollow people is a really beneficial tip. We have also heard that just taking breaks from tech is really healthy. And it's also really important for you to try and recognize how you're feeling as you're scrolling through Instagram or Pinterest or TikTok. Are you spending too much time? Do you feel like you're not getting as much value out of it? And if you feel like you're not, then consider maybe putting your device down and reconnecting with friends in the real world when we're able to do that again. It's pretty hard to do right now. And the very last thing that we've heard is just making use of all of the different tools that you have available to you. So we have comment filters, we have the restrict tool, we have privacy settings. If you're not comfortable sharing with everyone else, consider just sharing to close friends. All of these things are ways for you to really tailor not just what you see, but what you're sharing and who's seeing what you're sharing. And that can just lead to an overall more empowering experience.
All of our platforms are pretty different, right? And so Pinterest is going to be different from some other platforms, and they're going to be different from each other, right? So on Pinterest, it's less about following people and it's more about collecting ideas for yourself, right? We're trying to inspire you to go off and then do things in your real life. So that doesn't mean you might not come across something that might be triggering, right? I mean, I think like Dayna said at the beginning, right? Something that might be helpful for one person in recovery is actually might be triggering for someone else. And so even if we do our best job at trying to have good policies and take down things that we think are harmful, it doesn't mean that someone might not come across something that is not something that they want to see or that is harmful to them. So definitely report it. I think all of our platforms have options. You can report content right in that, you can report content right in the product. You can report comments on Pinterest. You can report pins. You can report tries if someone's saving a picture comment. You can report ads that you see that you don't want to see anymore and you want to tell us about it. And we take that feedback super seriously, right? We have people who look at those reports. We look at trends in those reports. That is super helpful for us. So definitely please report something if you see something that you don't think should be there. So that's one. And also, reach out and get those resources, get that support that you need. I mean, all of us, I think, try to make it really available. So if you do feel like you're struggling, please do reach out to experts like NEDA, reach out to your community and seek that out. And we do try to make it as available as possible for people. So I think that would be it. We really do try to think of Pinterest as personal media. It's not about necessarily following other people. And we try really hard to make sure the platform is positive and inspiring and welcoming for everyone. But we know we can always do better. And we do learn from that feedback from people.
The thing that we're really focused on and want to keep reiterating is that the safety is our #1 priority, but also empowering users to know what self-care means for them, know how their experience of these platforms is contributing to their own self-talk, and how they can identify that there's a negative self-talk happening there and then seek the resources they need to redirect that energy. And so one of the things we're really thinking through is, what does empowering users or creators mean? It means not only do they feel safe to be vulnerable or be their authentic selves on the platform, it also means they know what triggers them and how to prevent for that from something they might be seeing on the platform. And also not only what triggers them, but what will inspire them. And so maybe it's not necessarily having your whole feed around the awareness because it keeps it in your mind. And so you want to go find other dynamic pieces of content like the knitting videos we've talked about, or your sourdough starters that have been so popular in COVID-19. So that's another thing that we're just really driving home, is we want to set the bar so that there's no glorification, promotion, instruction around how to engage in eating disorders, but also that you're having a healthy and diverse experience on our platform. And as everyone else has said, of course, please do report that content, but also take a moment for yourself to think, can I engage in this right now, or do I need to put my device down, and do I need to go seek support from a family member and have a phone call with them? And then as you are able to report it on the app, know that there are other ways that you can customize your experience, like the long press that will make sure that you don't see any more videos from that particular creator, like you're filtering comments to make sure that the comments on your videos are ones that make you feel comfortable and empowered. And so just get to know the devices and get to know yourself.
Thank you all for a really engaging conversation today. I hope our audience has had the opportunity to take a deeper look into the work that you're all doing to create a safer and more inclusive space. We're really appreciative to be partners with all of you, and just from the bottom of my heart as a communications member of the NEDA team and on behalf of the team, thank you.